My name is Dr. Adam Becker, and I'm the Executive Director of the Consortium to Lower Obesity in Chicago Children. CLOC is a nationally recognized consortium housed at Children's Memorial Hospital, comprised of over 2,500 individuals from more than 850 organizations, all dedicated to the prevention of childhood obesity. In 2004, a CLOC study found that 24% of Chicago children were obese at kindergarten entry. In a 2009 report, mentioned by Dr. Arnold, released by the Trust for America's Health, Illinois had the 4th highest rate in the country for childhood obesity, with 21% of the state's children at the 95th percentile or above for body mass index, well above the national rate of 16%. Most of these children will have medical problems related to obesity later in life, and many of them may be dealing with these problems already. Obesity in childhood is also related to mental health and social problems such as depression, stigma, and poor academic performance. We can take on the cost of obesity prevention now, making the investments needed for effective prevention and treatment, or we can pay later the much higher costs that are associated with chronic disease management and underprepared students and workers. To address the epidemic, CLOC and partners conduct public education promoting our 54321-GO healthy lifestyle message. We work with partners to ensure access to fresh produce and safe opportunities for physical activity in Chicago neighborhoods. Our Healthy Teacher Network helps teachers to bring healthy eating and physical activity into the classroom. We collaborate on community-based projects such as the Healthy Kids, Healthy Communities initiative, which helps to ensure the city's parks are accessible to all children and families, and that healthy food is available to people when they're on park grounds or involved in park programs. While our work and the work of many others in Illinois is a good start, more is needed. We identify a few key actions as the most pressing. First, we must have regular and reliable information about the state of obesity in Illinois and its communities in order to understand where our resources and attention are most needed. For several years, CLOC has advocated for a child health examination surveillance system to collect body mass index and other child health data from the Certificate of Child Health Examination forms required from every school child. Second, we must build on the innovation and experience of local initiatives. Adequate funding is needed for evaluation and expansion to scale of those strategies found to be effective. Third, there is growing national consensus on effective clinical and preventive strategies to combat obesity that are not currently employed in Illinois. Illinois must keep up with the nation and bring these potentially life-saving approaches to our state. To accomplish these key steps, a state-level response to the obesity epidemic is needed. We must develop coordinated systems and policy improvements and leverage funding to permit investment on the scale that is needed. As the primary agency responsible for ensuring the health and well-being of Illinoisans, IDPH must take a leadership role in advancing the state-level response and must be given adequate resources to do so. Thank you once again for the opportunity to testify, twice. CLOC is proud to be among the efforts in our state that are committed to obesity prevention. We urge that a major focus be placed on childhood obesity prevention, as primary prevention is the best and most cost-effective approach to addressing massive health problems. CLOC looks forward to continuing to work with the Illinois Department of Public Health and other state agencies, elected officials in Chicago and across the state, and the Alliance to Prevent Obesity to advocate on behalf of the well-being of our state's children and the future of our population. Thank you.